Global healthcare experts are concerned about a hesitancy among people to be vaccinated against COVID-19. It comes as several countries, including Singapore, begin inoculating their populations. Well, a study has been conducted locally to understand vaccine sentiment in Singapore. And Associate Professor Edson Tandoc from NTU's Wee Kim Wee School of Communication and Information joins us now to tell us more. So let's just talk about that survey that you did of about 1,000 residents. 55% said that they would get vaccinated once the shots are available. 34% are sitting on the fence, while 11% say that they don't want to be jabbed. So how do you read into those numbers?
Well, first, 55% agreeing or strongly agreeing that they will get vaccinated when it becomes available here in Singapore is a very encouraging number. Although if we compare it with surveys done in other countries, say South Korea and China, the percentage of respondents agreeing that they would get vaccinated there is higher. There are, of course, differences in methodologies across these different public opinion surveys. In the survey that we did here in Singapore, we use a 5-point Likert scale. So we have a middle point that accounts for those who might be, as what you said, sitting on the fence. And 34% is actually a substantial number. And a lot of experts are actually most concerned about this group of people, those who are still hesitating. So vaccine hesitancy is defined as the delay in the acceptance or refusal of vaccines despite the availability of vaccination services. So these people are not entirely against getting vaccinated, but they're also currently unsure.
So, Professor Tandoc, vaccinations in Singapore, they are not compulsory. It is on a voluntary basis. So what are the implications for the goals that have been set by health authorities?
I think we need to really keep an eye on this group of the population that is currently hesitant about getting vaccinated. The thing is, they're not saying they won't get vaccinated. They're still unsure. So I think it's important for us to really understand the issues, the reasons for their hesitance. For this group, they have not made up their minds, so they may be looking for more information before they make their decision. And so we need to look into where they are going to get their information from, what kinds of information they are getting. We are in a situation that's evolving continually. So every day is a new day. So we need to keep track of these group of people and really track of how public opinion and attitude toward vaccination is changing, perhaps on a day-by-day basis.
Now, in your survey, as you've mentioned, about a third of those polled, they're hesitant to be vaccinated. And based on some interviews we've done, people are concerned because of the side effects. Aside from that, what else is, fueling their concern?
So experts have mapped out various factors that fuel vaccine hesitancy over the years and concerning different types of vaccines. So they've mapped out different groups of factors. So first, there are factors that are related to the vaccine itself. For example, the technology that is being used for that vaccine. The COVID-19 vaccines, for example, some of these are using a new technology. And for some people, this is something that's they're not familiar with. Also, there's another factor, the mode of delivery. So, people are thinking about, okay, if I need to have 2 doses instead of 1, what does that mean, right? So they're thinking about these things. Also, another thing that's associated with the vaccine itself is people's attitudes toward the source or the developer of the vaccine. So our attitudes toward the source or the developer might also affect how we evaluate the specific vaccine itself. Second, there are also factors that are related to the individuals, to us receiving the information that we're getting. So, for example, our past experience with vaccination, how is it like when we were vaccinated before? Some of us might have lingering beliefs about other vaccines. And so if we're hesitant about other vaccines in the past, that might continue with the COVID-19 vaccine now. Another factor that's related to the individual would be our level of health literacy. How much do we know about the science behind the vaccination process, for example? Also, a lot of people weigh the risk versus the benefits. So a lot of our our decisions when it comes to our health are actually related to how we perceive risks versus benefits. And also an important factor that is within the individual is how we perceive authorities. How much do we trust the authorities that are in charge of administering the vaccination program? And third, there are also larger factors, or what we call contextual factors. And this is where we focus on our information environment. For example, what has media coverage been like, not only in Singapore, but also in international media? Are the ways that the news media have covered the COVID-19 vaccine been helpful in increasing public health literacy by filling in, gaps in what we should know? Or has coverage been triggering more uncertainty or more confusion? And of course, fake news and other types of misinformation and disinformation about vaccination, these also pose a threat, especially at a time when many of us feel uncertain about what's going on, and we need information to manage this uncertainty. So, for example, if we are by nature a risk-averse person, it will be easier for us to believe in claims that the vaccine is risky, and maybe the risks might outweigh the benefits for us, regardless of whether the claims are backed by evidence. And the survey that we did here at NTU, where we focus on willingness to get vaccinated, we found some of these factors affecting the decisions as well.
Access to accurate information, so important in fighting this pandemic and in supporting the vaccination drive. Professor Tandoc, thank you very much for that. Associate Professor Edson Tandoc from NTU there, from the Wee Kim Wee School of Communication and Information.